Hey guys, this is Ada. I'm coming in to do a video this morning on iron, vitamin D, and magnesium. But my primary conversation is going to be about iron deficient anemia and probably directed more toward women um, because what I've learned during the last few months of going through some health challenges, how important iron is, and that anemia doesn't always show up. What's more normal for one person may not be normal for another person. And when you generally go to your practitioner, and they don't generally check for ferritin levels and all of that, they'll do like a complete blood count, and your levels may show a little off, but a lot of times many practitioners doesn't really think that it's a big deal. But for women who may be going through heavy cycles or just having a menstruation every month, that could be detrimental because if all of us are not created equal, and a lot of times what's considered normal for one is not normal for someone else. So, I can only tell you my story. I was tired, fatigued. I just really didn't have any energy to move, and it never really occurred to me that I may be iron deficient because you know um, it just didn't occur to me. I was having heavy cycles, but because I would miss 2 or 3 months and then I would have another heavy cycle, I didn't even think about it. Because first of all, I try to eat right and I incorporate a lot of things in my diet that contain iron. So that's one reason that I didn't feel that, I was iron deficient. So this is my story. Around July, around the end part of July, well, I would say more closer to August, I was just really tired and worn out, and I don't know, seemed like I had brain fog, and um, I just could not get out the chair. I had lost my job in July, July 31st, and even during the time I was working, I started to kind of feel kind of tired. And then at night I wasn't sleeping. I was having insomnia and all of that. And I'm not sure if all this is connected or not. But long story short, I developed heart palpitations. And just out of the blue, and at first I thought maybe it was just anxiety attacks. And I went to the emergency room and they said nothing was wrong. They did blood work and all of that and they couldn't find anything. So I'm sorry, let me back up. Before that, I went to urgent care and I did have a urinary tract infection. And I did ask them to check my iron, and they did, and they said it wasn't low. So, um, when I started having the panic attacks and went to the emergency room, I did ask the guy to check my iron levels. I think the second visit, and he did find that my hemoglobin was low. So by me knowing that I had extremely heavy cycles, it made sense to me. So I started going to a general practitioner, due to this anxiety and panic and all of this. And, they were saying, you're fine, your blood work is normal, and all these things. But meanwhile, I'm feeling bad or what have you. I started taking an iron, and I promise you my energy levels came back. Now, I was still having some other issues, but I was able to get out the chair like I am now and, be mobile and do things I need to do. Even though I'm having some other challenges in my health, the iron got me back up and got me back out. And I'm going to show you guys what I started using. The first iron I started using was called Hemi iron, and it's a natural iron, and it was a pill. I started using those, and it made a world of difference. And I took one 85 milligram tablet every day. And so this iron that I started using, I think this is my second bottle of this. This is Floridex. And I'm not being sponsored by them or anything, but this is my second bottle. I haven't opened it yet, but I've been taking this and it's helping, guys. And so there's stuff going on that I don't know exactly what it is, and I suspect thyroid or whatever, because I'm also starting menopause and all of that because I'm 51. But I incorporated the iron, and that made a world of difference for the energy. And so, guys, if you're feeling worn out, because it can affect other areas, and if it get too low, he could have some, detrimental effects on your health. So, if you start feeling really tired, and if you're a female and you're having heavy cycles, or you may not be having heavy cycle, but you're just feeling tired. The first thing I would look at checking is my ferritin levels or my iron levels to see if you're anemic. Because it could be detrimental to your health and your well-being. I was having breathlessness and all that, and it's taken me a while to recover. And what I also learned too, I've been asking for a vitamin D panel, because a lot of this stuff go hand in hand. Anemia, vitamin D deficiency, and all of that go hand in hand. But because they were slow to do panels, I already know, since I'm a dark skinned individual, I don't absorb sun as well as um, lighter skinned people or fairer skinned people. And they're saying now, it doesn't matter, that we need more vitamin D. And I know at that time I wasn't getting out in the sun a lot because I had lost my job, and I was pretty much in the house. And I was a little depressed because I lost my job. So I wasn't getting out in the sun. I wasn't, um, getting the proper sunlight that I need that contributes to the vitamin D. And I know I said it was going to be about anemia, but I wanted to talk about the vitamin D too. So guys, I started supplementing with vitamin D. And this is what I use. This is vitamin D3, and this is 500,000 units. And actually, it's only 125 micromilligrams. So if you're darker skin and you're not really getting out in the sun a lot, you may have vitamin D deficiency, which will cause tiredness, joint aches, depression. It will cause numerous things. So, have those vitamin D levels checked as well as your iron levels. And so when I was having the um, um, heart palpitations, or whatever you want to call them, I already would take magnesium, but I admit, I take 1 or 2 a day, because in my mind, I'm eating right. But guys, the food doesn't have the mineral content that it should have. We don't get the vitamins and minerals to our food that we need because the soil is depleted. And even if you're on an organic diet, it's probably wise to supplement. But I use magnesium citrate, and I also use a magnesium glycinate, which is decent too. The glycinate I like better, because if you take too many citrate, it'll have you going to the bathroom. But I take one of these and maybe 2 of the magnesium glycinate, which is more absorbable. And I'm gonna show you another thing too. My nails. My nails are growing back since I've been on the iron. And I really don't do anything to take care of them, but my hair had broken, it was very thin. There was so many things that went on because of these deficiencies, guys. And I'm gonna tell you, stress will deplete this stuff. And I had job loss, and there was other stressors that were taking place. So a lot of that probably contribute to those issues. So we need to be mindful to watch our stress levels as well as our eating habits, because I tell you, it could really be detrimental for a female's health, because, or anybody's health, not just females, but since I'm, kind of targeting this video toward females, it could be detrimental. So what I would advise anyone to do, get those levels checked. And guys, when I went, my magnesium levels, they were showing fine. My potassium level, all that. But by the time this stuff's showing your blood, you probably don't have hardly any. Because if they don't do certain tests, I used to work in a lab. If they don't do certain tests like an ionized test to see what's actually in the cells, a lot of times when they just do plain magnesium or calcium or whatever, he's not going to show what you have in your actually in your cells. So go get those levels checked, because it could be detrimental to your health. So those are 3 of the things that I take, and they have been helping. And I also take B12, and I take the methylcobalamin, And it's good because your body absorb it better. It's the natural form. But just make sure you're getting your vitamins and your minerals in addition to eating a decent diet, because the anemia and this stuff is no joke. These deficiencies are no joke. And you'll be surprised what vitamin deficiencies will cause and the health issues, because we need this stuff. I mean, our body need vitamins and need minerals, and we get that from our food, because the healthcare Western medicine is not really trained to treat the root. They just treat what's the disease. They're not going to treat the root. They're not going to tell you to do this and the other as far as nutrition. Some people take a holistic approach, but here in the West, most of the time they don't. So if you don't advocate for yourself and, try to help yourself and get informed about what you need to do for your health, a lot of times you're not going to get it from the healthcare industry. You'll get a bunch of pills to take to correct the surface, but the root issues will go on, because I've been handing anti-anxiety pills or what have you, and a lot of times this stuff is related. Anxiety stuff could be a magnesium deficiency, it could be vitamin D, it could be you low in iron. All of that. It doesn't necessarily have to be a psychological problem, which we do know stress does contribute to anxiety and depression. But likely, if you are having some type of stressor, a lot of times, if you have the proper nutrients in your body, you can kind of overcome it better. You can think about the next steps. But if you don't have the proper nutrients and vitamins and herbs in your body to help you adapt to whatever's going on, of course, it's going to be hard to overcome all of that. And sometimes this stuff is kind of sneaky, because we get busy living and we don't think about the stressors until they sneak up on us. And sometimes you can be doing all the right things and you still have these issues to happen. So, ladies, if you're having trouble with your cycles and heavy cycles, tired, breathlessness, anxiety, whatever, the first thing you probably need to check is your iron and see if you're anemic, because a lot of times they just don't check this stuff, and what's normal for one person may not be normal for another. So you have to listen to your body. You can't necessarily look at the numbers. You have to listen to your body. So this is what I use, and I'm not a doctor or a nutritionist, and I'm not trying to give medical advice, because I'm not in the medical field. But I can just tell you from experience what's helping me and what I'm continuing to do in lieu of not really getting the help that I need from the medical doctors, because a lot of times they just they just treat the symptoms, and if the blood work look fine or whatever, a lot of times they're not going to go any deeper. So you have to know, and you have to trust, you have to trust yourself, and you have to think about what's going on with you, and also you have to be prayerful about this stuff, because the Lord will point you in the right direction. He'll show you what's going on if you have that mindset. But other than that, you have to trust how you feel, and if it doesn't feel right and then it doesn't seem right and something wrong, don't let anybody convince you otherwise. And you just keep doing your research and till you find some answers, or keep going till you find some answers. Don't just sit and be passive about it. So that is and I talked about the magnesium, and this is very important mineral that we need, and we just don't get enough. You can get it from your leafy green vegetables, but a lot of times we don't eat quite enough vegetables or smoothies, and even if we do, like I say, the soils are depleted. And the D3, or vitamin D, we get it from the sun. But a lot of times, if you're not getting out your darker skin, you're probably not going to get what you need. And with this, you need to be taking the K2, because it helps the vitamin D absorb, and you need D3. Um, and the K2, I have K2, I just didn't bring it out. But you need the K2, and now they're mixing them together because the K2 actually have the vitamin D go to the right places and not go places it doesn't need to go. And when you mix the vitamin D3, the K2, and the magnesium together, it does have a big impact on your health. And there's some other things that I take as well, because a lot of my issues seem to be related to thyroid, and all this stuff go hand in hand. Low iron, vitamin deficiency, thyroid go hand in hand, because your thyroid is a very important gland. And a lot of times with women with hormonal changes, he can throw you a little bit of shift to the left or the right can throw your thyroid out of balance. And that don't always show up in your blood work. You know, a lot of times, unless they do very specific tests, it will not show. You can have all the symptoms, because heart palpitation or racing heart, all that come with a thyroid issue as well. But sometimes the thyroid is responding to something else going on in the body. May be responding to an iron deficiency or a vitamin D deficiency. That's when it's important to get those levels checked. And now, unless you can go to a functional medicine doctor, because they don't tend to take insurance, I don't think, that treat the root cause. If you're fortunate enough to have one in your area, or you can afford to go to one, to me that's your best option, because they will get to the root and they're going to check the panels first, unlike Western medicine. You know, they don't do that first. They look at the blood work and general blood work. They have panels that they do that they've been trained to do in medical school, and if those aren't off, there's nothing wrong. But now if you go to a functional medicine doctor who take a holistic approach, what they're going to do, they're going to start with the vitamins panels first, the thyroid and stuff like that, and they're going to do more than a few tests. They're going to check for things that the Western doctors don't normally check for initially, because they will send you to all kind of specialists. You know, you'll be running to 10 different doctors really for different things, and sometimes it's just so simple as doing a test, but that's just the way it is. So with that being said, I'm gonna end the video, but you know, ladies, get that iron check. This is Floradix, and it's good. It's got some herbs in it. It's iron, but it's also got different herbs in it. It has rose hip, wheat germ extract. It has fennel, kelp, hibiscus. Have a lot of good things. Stinging nettle, carrot root, spinach leaf. So we have a lot in it, and it does have ferrous gluconate as iron. It's 10 milligrams of that. And you know, sometimes I take more milliliters some days, depending on what I think my body needs. But typically it takes about 6 months to get the iron stores back up to what they need to be. So sometimes it can take a while, but just make sure, you know, you do what you need to do to advocate for yourself, because you know, with so many different professionals, you have your general practitioner, then you have these other specialists and what have you. Like I say, you can end up with 10 different people, you know, for one thing. It's not like it used to be, where you go to your doctor and you know you have that one person, and if you know they deem necessary, they may send you somewhere else, but it's not that way these days. So do what you need to do to take care of yourself, and I'm gonna end this video. So just remember the magnesium, the D3, the iron, and the K2. The K2 you need to take with the vitamin D3 for it to, you know, to work right. And those are just a few that I use, and I'll come back and talk about some more at a later date. So for now, have a blessed day, and you know, take care of yourself. Bye. And if this video has been helpful to you, please click like, share, and subscribe. Thank you.